All right, so welcome everybody. This is Roberto Dandi. I'm a faculty member at the Pontifical University of the Holy Cross in Rome, where I teach management in a course called the Program of Church Management. You see in the background the website of this course. This course is a very innovative course. We started 3 years ago because the Pontifical University was asked by the Vatican to run a program like this to help the church in becoming exemplary in the implementation of Catholic social teachings by means of implementing the best business practices and be true to its mission, that is, of course, evangelization and winning souls to Christ. So this webinar is is organized by the program of church management. It's actually a speaker series. We have many events like this. This is one of them. The speaker series is called Stewards of Providence, Making the Resources of the Church Fruitful. And these webinars actually fit very well with the mission of our program, because we want to leverage on experts that we find around the world and learn from each other, so that the church can be more efficient and effective in pursuing its mission. Today's webinar is about holy entrepreneurship. So as we wrote in the abstract of this webinar, the church is called to break away from the comfortable mentality and embrace a missionary spirituality of going at the ends of the earth like the early missionaries. And this is, we think, from a management point of view, as a management scholar, we think this is a real entrepreneurial venture, because, as you may know, an entrepreneurial mindset is defined as the ability to sense, take action, and get organized under uncertain conditions. So we think that the competencies of any entrepreneur are very well represented in the missionary activities of clerics and lay people that go around the world to evangelize. And so they spot opportunities, they develop creative ways to evangelize, they mobilize resources, they take actions by coping with uncertainty and risks. And so we think that these competencies very well fit with the definition of entrepreneurships. So we invited two representatives that may very well describe and talk about these issues. The first is Professor Barbra Wallman, professor of nursing at the University of Virginia in the US. She wrote many articles and books about the history of religious orders, especially in healthcare. She wrote books like this one, Unlikely Entrepreneurs, where she tell the story of many epic ventures of Catholic sisters in the US, really missionary sisters when they started in the 19th century. And also she wrote another book about the same issues in Africa, so into Africa. And so very readable and important books, I think. And so we will hear from her the story of some of these ventures. So we will try to learn from these stories to understand the importance of entrepreneurial skills for the missionary. And we have the other speaker is Sister Anne Falola. She's a missionary sister from Nigeria and General Councillor in the Missionary Sisters of Our Lady of the apostles. So she will tell us from the field work what it means to be entrepreneurial in missionary activities. So welcome to both our speakers. And I think I leave the floor, I give the floor to the first one, Professor Barbara Wallman, and thank you for being here. Thank you for your availability. And also, I just want to remind those attendees who just joined us that if you want to send questions to our speakers, you can do that by clicking on the button below, at the bottom of your window. There should be a button called Q&A. So do not send the questions in the chat, but just by clicking on this button, and we will address the questions at the end of this webinar. So without any other waste of time, I give the floor to Professor Barbara Wallman. Thank you.
And you can see my slides and everything's set up, correct?
Yes, we can.
Wonderful. So I want to thank Dr. Dandi. I want to thank Sister Ann and Alessandro and all of the people with your institute for making this possible, and I'm delighted to share my work with you. As a historian, I've argued that there are uncomfortable tensions between the sacred and the secular, tensions that still exist and must be confronted. As an example, most Catholic hospitals, whether in the United States or in other countries, have to balance their missions to serve the poor and marginalized with their financial balance sheets as they operate their institutions on business models. Yet for Catholic hospitals, spirituality and economics are not opposing forces. Since the mid-19th century, Catholic sisters have established medical institutions across the world. I call these sisters entrepreneurs. And as this conference testifies, entrepreneurial skills are very important for the missionary. To build their hospitals and compete in a growing hospital marketplace, sisters had to develop sound business models, advertise, do market analyses, and receive training as executives, nurses, physicians, lab technicians, and eventually pharmacists and anesthetists. They raised and borrowed money and established their own corporations. Yet sisters' work was different from other businessmen and women. They had to develop a model that can be called holy entrepreneurship. We can infer patterns in sisters' holy entrepreneurship by examining historical accounts of their hospital establishments as they developed uneasy alliances with secular authorities. Now, the focus of this paper is on the United States and Africa, although sisters also established hospitals in Asia, Australia, and Latin America. First, I'll talk about the sisters in the United States and their European links. Now, this is a slide of Sister Ignatius Farley, a sister of St. Joseph from Wheeling, West Virginia. I'm interested in how women like Sister Ignatius, an Irish immigrant who came to the United States just before the American Civil War and worked as a nurse in that war, became this. What you are viewing here are the owners of the Catholic hospitals across the United States in the 1920s. And this is two halves of the same picture to give you an idea of the large number of people. Most of these women were European immigrants, mainly Irish. And when they first arrived on American shores, they had no money. Furthermore, the public face of Catholic authority has always been decidedly male. It's ironic then that most Catholic hospitals in America and other parts of the world were established and originally managed by women. And you can see all these women in this picture. They could not yet count on the church for aid. It was a poor church at that time. Yet these sisters were in the vanguard of healthcare beginning in the mid to the late 19th century. They did things the rest of us urgently need to learn, particularly around questions of power, humility, organizational leadership, nursing practice, and transformation. Historically, Catholic sisters have had a mission to care for the sick, the injured, the aged, and the dying. In the 17th century, St. Vincent de Paul and St. Louise de Marignyac's Daughters of Charity were going out into the streets of France to do nursing. Moving to the 19th century, sisters established hospitals at a time of rapid economic development in Europe and elsewhere. In the United States, push factors in Europe such as famine and religious persecution, and pull factors in the United States such as available jobs and land, increased the number of European immigrants to the United States and more than doubled the total number of Catholics by 1860. Church leaders sensed that significant Catholic populations existed with inadequate spiritual institutions, which included hospitals, and sisters led in this hospital establishment. As they expanded their healthcare in America in the wake of immigration, they faced Protestant hostility that arose from anxieties over Catholics' obedience to the Pope and priest, which Protestants thought was incompatible with Republican citizenship and religious freedom. Catholic leaders counterattacked this nativism by attempting to demonstrate the Church's compatibility with American democracy. Because of the prevailing anti-Catholicism, however, Catholics formed strong attachments to their own institutions. Now, while Protestant growth occurred particularly in the southern regions of the United States, Catholic enclaves of European immigrants predominated in eastern cities such as New York, Boston, and Philadelphia, and also in the Midwest in places like Chicago, St. Louis, and St. Paul, Minnesota. The Catholic Church was in the minority in Texas and in Utah, but these areas attracted many immigrant miners and railroad workers from Catholic countries who were potential American Catholics. So Catholic sisters went to all of these places. They also established relationships with the mining and the railroad owners and operated early insurance programs. And these are pictures of slides. On your left is the Holy Cross Hospital in Utah. And this was an ad for the miners because they had an insurance program for them. And on your right is St. Mary's Hospital in Minneapolis, Minnesota. These sisters contracted with the railroad workers for insurance programs. So in 1823, nuns first began staffing hospitals in the continental United States at the Baltimore Infirmary, where they charged a small fee for admission. Here, university officials asked the Sisters of Charity from Emmitsburg, Maryland, founded by St. Elizabeth Seton, to staff the infirmary. And you can see her picture here. In the process, sisters had to construct a kind of nursing and hospital management that focused on accountability, innovation, skill, and flexibility. In the turmoil of immigration, sisters contributed greatly to the production of something new: the modern hospital and the modern nurse. Sisters' prayer life and their healthcare ministry intertwined as they worked in the hospital market. Now, the American Civil War that lasted from 1861 to 1865 was a defining event for the Catholic sisterhoods in the United States. 600 sisters from 21 different communities nursed in military hospitals, U.S. Navy hospital ships, and prisons. Other sisters converted their own hospitals into Army facilities. Most women nurses of the day were untrained, but some of the sisters were trained. For example, the Daughters of Charity in Emmitsburg, Maryland, had been educated by Mother Xavier Clark, who wrote instructions for the care of the sick in 1841. You see her picture on the left and her book on the right. In this book, she taught sister nurses to respect both bodies and souls and not to be like the secular nurses who worked for money. Selfish intentions were in opposition to any calling of a religious sister. She also taught sisters how to give medicines, how to be leaders, but also to how to pray for the sick and the dying. Sisters' prayers functioned as invitations to religious experiences and means for patients to meet God. So these sisters coming to the Civil War, many of them who had read her book, were ready and waiting and prepared. Sisters also worked with the government in ways that became innovative models of church and state working together. For example, in 1864, the Sisters of St. Joseph in Wheeling, West Virginia, contracted with the Union government for $600 a year for the sister nurses to care for soldiers at their hospital in Wheeling. The superior was Mother DeChantal Keating, who you see here. She was a young Irish immigrant who had come to America during the Irish famine years of the 1850s, and she strongly emphasized economic security. On February 8, 1865, Mother Deschanel personally appealed to authorities in the War Department in Washington, D.C., when the Army was delinquent and paying rent to the sisters. She presented her accounts and her certificates and did not leave that guy's office for 2 weeks until the quartermaster informed her that all arrears would be paid. She and her sisters had a strong religious commitment to their work, but their entrepreneurship led them to expect the government to uphold its end of the deal as well. Mother Deschanel's perseverance was significant. Wartime was an especially important time for sisters to demonstrate their skilled nursing care and their loyalty to the government, and their work helped enhance the general public's perceptions of Catholics. It was crucial then. So after the American Civil War, Catholic hospitals in the United States arose alongside the development of other hospitals during a growth period of science. Hospitals were growing all over the United States. But from the beginning of sisters' hospital establishments, they had an expanded idea about illness and its treatment. They certainly accepted the values and orientation of modern Western medicine, and you can see them here participating in surgery. But they also believed in supernatural causes and treatments based on a long-standing Catholic devotional culture. They developed a space in the United States where a specific, socially beneficial type of care could be provided and purchased. These insurgent sisters brought into being new hospitals with different economic models, those in which authority depended not on male physicians or church leaders or even state support, but on the ability of the women religious who convinced other people successfully to have confidence in the hospitals that they created. So how did the sisters do this? They had to charge patients in their hospitals from the very beginning because of the lack of Catholic donors. Protestant hospitals didn't charge from the beginning. They did later, but not from the beginning because they did have donors, but not the Catholic ones in the early years. For the sisters, paying patients could help supplement the care of those who could not pay. Sisters linked charity and market activities for charitable reasons. This holy entrepreneurship had long been successful for them in Europe, where they had contracted with the government and medical authorities to run hospitals in which they could combine evangelism with nursing skill. The pragmatic sense of themselves as service providers made sisters keep statistics, boast to the public about their positive outcomes, and highlight significant cures in their hospital brochures. They knew that without these activities, their hospitals could not attract the best physicians, offer the best services, compete with other health systems, and raise money needed for operations. So after the 1920s, though, the United States was no longer considered mission territory, and the sisters looked elsewhere. Beginning in the 1930s, women of the Catholic Church began playing greater roles in the church's healing mission around the world, and entrepreneurial skills were equally important for these ventures. The missionary orders organized training programs to equip themselves to include entrepreneurial and professional skills before sending sisters to the missionary field. For example, under the leadership of Austrian-born Anna Dengel, shown here, a medical mission sister, sisters established a new position for themselves that combined religious commitment and medical science. Dengel and others had worked with the Pope to change a centuries-old policy that had prohibited Catholic sisters from practicing medicine and being doctors. They could do nursing, but they couldn't be doctors. But after 1936, they were able to become surgeons, midwives, and obstetricians, thanks to the work of Dr. Dengel. They studied in medical and nursing schools and universities in Europe and the United States, and in the process, they embraced the power structure of the Catholic Church and what it could provide them. International politics provided openings for Catholics to go to Africa after World War II. In sub-Saharan Africa, as the voices of independence grew louder, British and other colonizers came under international criticism and increasingly were unable to sustain their colonies. Within a decade, they began moving out in droves. Consequently, indigenous populations struggled to realign their countries and begin the arduous process of self-rule. Catholic women's religious congregations whose work in Africa had been hampered by World War II, excuse me, now saw themselves playing a supportive role in this transition process by expanding their medical missions. They did so in the context of an accelerating worldwide Catholic missionary movement. In the 1950s, there were more foreign missionaries in Africa than ever before. When the sisters first went to the mission fields, they took their full arsenal with them, their Christian faith, and their own biomedically trained physicians, surgeons, obstetricians, pharmacists, nurses, and midwives. As elsewhere, they started with humble beginnings and makeshift facilities. They raised money with friends and family members back home. Although sisters were well trained in colleges and universities, when working in the bush or holding clinics during wartime or other periods of violence, which often occurred in the missions, they faced new challenges. There were rarely enough sister doctors in mission hospitals, and sometimes they had to perform unfamiliar surgical procedures. One sister doctor would read instructions from a textbook as she operated. Yet from these humble beginnings, and with God's grace, Catholic sisters blended business acumen, science, and religion. Mission hospitals were sites where one could witness a variety of healing practices. One hospital administered by the American Maryknoll Sisters in Tanzania was such a place, and this picture on your left is a Maryknoll sister in Tanzania. In 1949, a sister delivered a premature baby in their hospital, and the baby did not thrive. And after performing life-saving measures, the sister eventually gave up and baptized the infant. Yet she had also allowed an indigenous practitioner into the delivery room. According to the sister, this person beat some sort of a cooking pot, which she held over the baby's head, and chanted a song to ward off the evil spirits. Well, soon the baby began breathing. Now, sisters also believed in miracles. In this case, the sister attributed the baby's survival to the baptism and to a miracle rather than the work of the indigenous healer, but she did allow that healer into the operating room. Medical mission sisters also went to Ghana, and this is a pharmacist in Ghana and also in Uganda. I believe this particular picture is in Uganda. So those were the medical mission sisters. The medical missionaries of Mary from Ireland established a large presence in Nigeria, and these sisters are on the right of your photo. Now, these are just examples of some. There were many others. But in all of these mission endeavors in Africa, the sisters had greater financial help by this time, not only from the Catholic Church, but also Catholic charities and wealthier Catholic donors. The medical missionaries of Mary, and this is several slides of them, had come to Nigeria in 1937 to do both mission and medical work. In the 1960s, however, they shifted their understanding of mission toward humanitarian entrepreneurship. Sister Pauline Dean, for example, and her fellow nurses, physicians, and midwives stayed with priests and patients during the Nigerian Civil War from 1967 to 1970. This is Sister Elizabeth Dooley. This is Sister Pauline Dean. Again, Sister Pauline here and Sister Elizabeth here. Sister Pauline, Sister Elizabeth. But it also shows several Nigerian nurses working alongside the sisters. At that time, 1 million people, mostly unarmed civilians, including women and children, lost their lives. The Irish missionaries, sponsored by the Catholic Church, provided wide-ranging humanitarian relief and medical care. So these sisters, they brought their experiences as nurses, as doctors, and they have their trained nurses here, and they developed innovative interventions with and by their patients rather than delivering to and for them. In Urua Akpan, for example, on March 25th, 1968, Sister Pauline Dean, midwife Sister Elizabeth Dooley, and Nigerian nurses treated 45 outpatients as planes flew over them with bombs. And then they worked in the operating room all afternoon. In the eastern region, called Biafra, military operations were the most active, and farming could not take place. Famine resulted. Thus, an international ecumenical airlift began operating. This was another example of holy entrepreneurship. It was funded by worldwide Protestants, Catholics, and the American Jewish community, and they formed the Joint Church Aid organization. So much of the relief materials raised internationally came through this agency. And these are members of that organization. These are people who flew in the aid. World Council of Churches also cooperated, as did Africa Concern, the Catholic charity group Caritas, and Oxfam. Now, all of these agencies proclaimed their neutrality, but they were still under gunfire as they flew in medicines and food to be offered, despite the fact that the Nigerian government had banned outside flights. Again, they knew that something had to be done. Another photograph shows Sister Joseph Teresa Agbasieri. She was a Biafran Holy Rosary sister, and she's caring for a patient at a feeding station during the war. She's with a woman who had dusted her baby with chalk in an attempt to heal it. So these photos are important in showing the local response of Nigerians caring for themselves and working alongside the sisters. Thus, the sisters had another key resource on their side: Nigerian sisters in their congregations and in others who could maintain the hospitals after the expatriates left. The Nigerian Civil War ended in 1970, with the Irish Medical Missionaries of Mary being expelled from Nigeria. They had stayed because they thought the suffering would be greater if they did nothing. But the consequences of their involvement in the Nigerian war were huge because they lost their hospitals. And some sisters died during the war. But what was lost for the Irish sisters became an opportunity for Nigerians, and a different kind of entrepreneurship was required. The Catholic Church had been slow to indigenize its institutions. European Americans and American sisters had gone to Africa with the idea of eventually turning over their hospital operations to the Africans themselves. And they had been training African nurses for decades. So Americanization of church institutions did in fact occur, and it increased in Nigeria after the Civil War. And eventually sisters were able to get help from the state government to keep their institutions going. And these were two of the sisters who were very active in those Nigerian missions. So yet another example of sisters' innovative entrepreneurial roles is that they began expanding their mission to local lay workers and experts. As nuns came to understand the mission environments and the needs of their hospitals, timing was important. They had to change as market forces or world events changed, and sometimes this involved disrupting the status quo. They took bold leadership roles in navigating difficult political and economic environments, including wartime environments. They established modern hospitals based on sound business models with professionally trained physicians and nurses so that patients could increasingly be exposed to scientific and technologic medicine. They worked in a secular marketplace, but in an environment that disclosed the sacred. And these pictures show all the many ways that sisters were able to do this. So in conclusion, these sisters exploited new opportunities and refused to give up, whether in wartime during the Civil War, whether in the civil in America, whether this in the Civil War in Nigeria, or in other areas where sickness and epidemics were ripe. These sisters were there. Their successes in finding common ground and building coalitions among different entities had provided valuable working models for how to blend the sacred and the secular. This wholly entrepreneurial model, where they cultivated a web of economic, religious, and professional ties, linking them to their patients, can be an important guide for any strategic policy for improving healthcare for the world's citizens. Thank you.
Thank you, Professor Wallman. This was very, very useful for us. It's, if I may bring a metaphor, you know, during Easter, we just experienced the Lord saying to the women that were approaching the tomb, he said, so tell my apostles to go back to Galilee. It's like this. We have been brought to Galilee, and we just experienced the sources of many entrepreneurial ventures in this speech, and it was like understanding how many ventures started in the first place in the US and in Africa. So now it's time to see if these things, these experiences apply to the present world, so to the present situation, even these difficult times of health crisis with the coronavirus in place all over the world. And so I ask Sister Ann to speak about his experience, and so I give you, Sister Ann, I give you the floor for your presentation. Thank you.
Thank you, and thank you very much, Dr. Barbara, for that very insightful presentation. And I know some of the faces you were speaking about, and really they did a great job. I'm going to talk now on holy entrepreneurship, the entrepreneurial skills of the missionary. It's a testimony of my own experience, but also sharing with you some of the experiences and things, insights that have helped us as Sisters of Our Lady of Apostles in our mission, especially in Africa. Sisters of Our Lady of Apostles were founded in 1876 in France, and especially for the missions in Africa. So we have almost 150 years of continuous missionary service to Africa. And the vision of our founder was to see the zeal to see God's kingdom expand in Africa. We are dedicated to primary evangelization, education, health, pastoral work, social development, promotion of justice and peace. Interreligious dialogue, especially today, is very important to us. And we always have special attention to the most vulnerable, particularly women and children. All these commitments are rooted in our desire to proclaim the good news. So pastoral commitment is an integral part of all these activities. The slogan, to know God, to know and love God in order to make him known and loved, gives meaning to our mission. And that's why I start with this question, why do we do what we do? Because reflecting on this topic, I said the major motivating factors for business entrepreneurs are profit, fame, and domination of the market space. But for us, what motivates us? For us, it is the zeal to know God. And I want to ask everybody to ask himself or herself what exactly motivates them in their missionary activity, because that's the starting point. And I want to share two experiences. One is my personal experience, and the other is a mission we have in Bugisi in Tanzania. I want to share concrete insights of how this mission developed and what has helped us as we build this mission. Bugisi is a rural mission, and it's the OLA sisters were invited to that mission in 1994. It was a small clinic with one small ward with no structures on ground. But today, it is a very large mission providing many valuable services, which include a full-fledged health center with many outreach programs to the surrounding villages and rendering many high-quality and affordable health services, including HIV tests and treats for thousands of patients, maternity services, inpatient, outpatient, eye treatment camps, and the list goes on. Also, that mission in the past, within this 25 years, it has a women development center, which I will show you as on this slide, which has directly benefited over 5,000 young women with life skills, cookery, hospitality, business skills, knitting, sewing, soap making, batik designing, also with outreach to surrounding villages. The center has been upgraded and registered as a vocational training center with official certificates by the government. It's also training men now. There is a fourth project on the same mission ground, an English medium nursery and primary school, providing quality education in a rural area, serving many of the surrounding villages. It was founded only in 2013. Now it has almost 400 pupils. And the last but not the least on the project on this particular mission is oil pressing mill to help the farmers in the locality to process their harvest by processing the sunflower oils for them. You can see the vision in all of this. So I just show you some of the activities that are being developed, headed, coordinated, and managed by sisters on this particular mission. And how did this little mission transform into a hive of activities, transforming so many lives? What factors contributed to this success? This is what I'm going to share with you. The missionary sisters are the head of it, as I said, and I'll just give you a quick list of some of the things that has helped us in this work. Number one on the point is strategic planning and regular evaluation. Sisters, as good entrepreneurs, we are constantly meeting, planning, focusing, and evaluating what we are doing and how does this respond to the needs of the people. So Bugisi, like all our missions, benefits immensely from good planning. Time and resources invested in meetings for good planning is very important to us. And such programs, sometimes we ask experts to come and help us to facilitate this for us so that we can enhance our organizational skill and team spirit. So the pictures there show some of the planning meetings that the sisters have in order to continue. These meetings actually takes place statutory twice a year, one general one and one core one for those on each project. But there is a general one for everyone together annually, and it helps in planning. The number 2 point is that we are never afraid to start small. You know, you could dream big, but when your resources and the reality around you, you are surrounded by poor people, it is great to start small with them. As we usually focus on primary evangelization, it is normal for us to work with poor communities. The pictures you are seeing there are the pictures of those who have been displaced by Boko Haram in northern Nigeria. And so we go into them to start learning skills instead of waiting for handouts. So we just start with something. We don't need to wait for restructures. We don't need to wait for any big thing to happen. We just look for a few chairs, a few tables, and we started right in the camp with the people. So this kind of spirit is really very missionary, but I realize it's quite entrepreneurial. And it makes a missionary to be flexible, to be passionate, to be enthusiastic, and it keeps the mission alive. And we are also risk takers. You know, business entrepreneurs are experts in taking risk, and so are we. Sometimes we need to go to difficult places, and we move ahead because we believe that the power of God is with us. With all the prudence that we have, we could, but we try not to be deterred by the dangers. Again, this picture shows you know, going into some of the front lines where the people really need help. And, you know, following our own charism and belief that the people there need help, and that is far more important to us than maybe the fear that as human beings we all have. The next thing that I think is very important for our mission as we grow them is to be ready to respond to new challenges. It is important to be open and courageous to respond to new challenges. For example, in Bugisi, in the past 26 years, the sisters keep reflecting on the new challenges and they respond accordingly. For example, the Women's Center was upgraded because there was a need to upgrade it. It started as a small center for women. They even didn't have a room, but it has become a big place now because the reflection was ongoing. The health center needed expansion, and little by little, it was growing. The oil press was a reflection of the needs of the people in the village. They needed to process their products. So the sisters went into dialogue with them. What do they need? And it was facilitated with the help of funders to get an oil mill press so that they could process their products. And the last but not the least was an English medium school so that the children could get access to good schools in the cities. So when you are a missionary and you have this spirit, you are never static. You are attentive to the signs of time and you are responding. You have a vision, but you don't have a fixed agenda. You are open to what each day brings and what the needs of the people are. Then we also find it very important that we ourselves, we need to update our skills and continuous training, ongoing formation, both at the professional level and at the spiritual level. Updating might be informal. Many times you don't have the means to go into big, long careers updating, but we just take time to read, do peer sharing, we do short courses, and we acquire new skills. And with this, we are able to keep updating on the mission. The important thing is to always be open to learn and learn together with the people to whom they are sent. The number 6 point I have here is to keep the eyes on the ball. We keep focused. What is your focus? You know, many of us religious, we have our special areas. Some are basically medical, another is educational, another is maybe an outreach to the especially handicapped persons. What are your own specific focus? I think for us as Sisters of Our Lady of Apostles, we focus a lot on women and young girls in vulnerable situations. So whatever we can do to make life better for them, we enter into it. And some of this affirms our identity and our charism. So I think for us to succeed as entrepreneurs, we need to keep our eyes on the ball, to stay focused on our own particular mission, because we cannot do everything anyway. And then another important point I put as number 7 is to build simple relationships with the people. This is what we do every time as missionaries, because mission is not just about big projects. It's more important for us to touch people's lives. Missionaries are people-oriented. We leave memories in the minds of the people to whom we are sent. They become our lifelong friends. We are part of their lives, their story, and this is for us a very important part of the mission to which we proclaim to them. And then number 8 points that we have is we equip people. We leave legacy behind so that people, they don't just come and leave us the same way. One of my main sources of joy and satisfaction is when I look at the number of people, especially women, which OLA sisters have either educated, cared for, trained in our long years of engagement. You know, you go to a village and you see that most families have linked one way or the other with the sisters, either because their babies were born in the hospital, or their children attend the school, or the woman is learning a new skill. Everybody's life is being touched, and a legacy is being built around people to change cultures, to permeate and bring transformation to people's lives. Patience and perseverance is a very important part of that. Many of us are in the era where we want quick results, and we want everything to move fast, but mission is built with patience. Another very important part is record keeping, which has helped us a lot. Our donors will not thank us, and they will not give us again if we do not keep records. So transparent records in all our projects is very, very important. When people give, we must give them the report sheet, and the report sheet is transparency, accountability, both in terms of money and output. And then to be connected to the concrete needs of the people. If people need housing, we are not going to start building schools first. If people need food, we are not going to start looking for, you enter into the reality of the people, and in this way, people connect to you. People answer you when you call them, because you are solving a problem for them. Team building, we work together as a team. Whatever mission is there, all the projects belong to all the sisters, and we work together, and we also network with other institutions who are either, you know, doing something similar or share the same dreams with us. Number 13 is to promote volunteering. We have grown in this aspect very much in recent years, where people are part of our mission by volunteering a few months, some years, and they take part and they expand the mission in this way. So it's a way of networking, of collaborating, and making everybody in the church share in the mission of the church, which belongs to all of us. I believe that a lot of questions will be raised, and I just want to finish with this quotation, which is from one of the books I've written on a mission as a reflection. Mission is not an event. It is not attained as a once and for all achievement. It is a continuous engagement with reality. Mission is journey, not simply arriving. It is questioning, not providing a simple answer. It is searching, not finding a once and for all solution. I think we are all searching together. Thank you.
Thank you, Sister Anne. You really succeeded in summarizing a handbook about holy entrepreneurship in few minutes. Thank you very much, and for your experience in real world experience in this venture. Thank you. And so now it's time to answer some questions that we received. Before that, I want just to greet and thank for their presence the people here that I know, and I see some students of our program of church management, some teachers, and also there is the director of the research center under which the program of church management is run, Monsignor Martin Schlag. I thank you for your presence, and also he sent us a question that I want to address to our speakers. And could you say something about the challenges to Catholic healthcare at present and in the future? What about the lay people who, moved by their faith, started hospital and hospices So how to involve them? So this is the question. And who wants to respond? Maybe Professor Manwol?
Yes, I just returned recently before all of the travel bans. I had gone to the Catholic Health Association meeting, and they were dealing with this very question. And what is happening is that, of course, the sisters are moving out. There are not that many sisters in healthcare anymore, and so they are hiring their lay leaders. But they have a wonderful training sessions for these leaders, and the training goes on probably over a period of a year, and sometimes this whole, they'll have retreats over the summer so that these leaders are trained in the sisters' missions. And in all honesty, one of the sisters approached me after I had talked, and she said, when you think about how innovative sisters have been in the past, this notion of turning over their institutions to lay leaders, but training them to do so is also very innovative. And the key is developing over here, and with these big hospitals, the key is to develop the leaders. Now, the challenges are huge because of the money. And what the Catholic hospitals are facing with now is, so why are you paying your chief executive officer so much money when you don't have services to do other things? And that's a challenge that the Catholic hospitals have to face, and they're trying to deal with it. And one answer that the sisters don't really like, but it's one answer, is that, well, the only way you can compete is you have to pay the CEO the same amount that other hospitals would pay him, and that's how you're going to get that person to stay. So there's still challenges, very much so. But the sisters and the Catholic hospitals themselves, I think, are taking great steps now, and are working very hard to stay open in areas where other hospitals are closing. And that's to the Catholic Church's credit, that they're really, when they have this commitment to the poor, that's important to them, is to stay open.
Thank you. We have another question from the director of the Department of Development Studies at St. Joseph Theological Institute in South Africa. And so one question, he sent two questions. One is about the current situation. I want to ask Sister Anne about this. So he says, after this global COVID-19 crisis, digital economy will have a greater importance in our lives, and the church must be different in using these technologies. The challenge will be the increased exodus of Generation Z Catholic laity to the digitally relevant Pentecostalism or other denominations. What do you think about how can we be entrepreneurial in this current crisis, in this current situation?
Thank you. I think that it's very tempting to really compare ourselves maybe with others who maybe have other methods, of reaching out to the people. And with this current crisis, of course, there is a lot of use now of the digital technology. And a lot of the poor people we serve are actually out of that circle. I think we've got to take it little by little and be patient with them. And I think we also need to start small, even with that. A lot of people now, at least they have the basic telephone. So in some of these missions, we now use telephones to even pass messages to them. So maybe they will not be able to do a Zoom conference like we are doing now, but at their level, there is something we could do. Always to go to that level and see what is practical and what is possible, and do the maximum you could do at that level. Because the temptation is to compare a level in a village mission to the level maybe in the capital in Rome. That level will definitely be different. But we just need to be attentive to what is the maximum possible where we are. And we do that and be contented with it. That is my answer for that. And
Yes.
somebody has asked me here, can I go on with that?
Yes, sure.
how we manage with the financial resources, which is a very important question. Definitely, when you start a new mission, that mission is not going to be self-sufficient immediately. That is where we need the support of the entire church whenever a mission is starting. We need the survival of the missionaries themselves, because they are not going to start asking people to get their own means of livelihood, and of course to set up the basic structure. But every mission gradually becomes self-sufficient. Every mission gradually becomes, and that is what we work towards. But this does not happen immediately. The missions we started 60, 70 years ago in Lagos, Nigeria, now the capital, they are self-sufficient. We don't need to look for somebody to send money. They send money to others within the country or within Africa there. So we need to be patient with a new mission we start. Even in the same country, there will be poor areas where the missionaries will always need a financial support of others. And that is where mission is complex. So that is it. But we must be transparent and accountable when we get this money, so that people know that the money goes for the mission.
Okay, another question for Barbara by the director of the program of church management, Luca Mongelli. How should we manage the delicate balance between the need for running a business under the business logic and the final goal of accomplishing a really social impact? Can the market foster such a social aim, or is it only a necessity that only creates obstacles?
So, in all honesty, some of the Catholic sisters who have run hospitals are getting out of the business because, and I'm afraid that there is some background noise. I hope you all can still hear me. That's the problem of working at home, noise on the outside. Anyway, some of them are getting out of the business altogether because it's hard to reconcile business and evangelism. Others are not. They are committed to it because caring for the sick is part of God, and they see themselves certainly as missionaries to care for the sick. Go ye and take care of the people, and that's what they're firmly committed to that. It's their charism, and it's hard. I think what they have learned to do is to live with ambiguity. And as historians, I've had to learn to do that too, is that they realize that that the market is there. And if you're going to have a hospital in the United States, you have to do it, you have to be a part of the market. But they are very careful in being very good stewards with their money. And they have, that's so important to them. That's and then they also can use the profits from these better and larger institutions than to help with their smaller institutions that are poor, so that it's not, they really are what we call not-for-profit hospitals. They make money. The patients' fees and all of that stuff brings in money, but that money doesn't go to the Catholic sisters or the owners of the hospital. The money goes back into the hospital and back into taking other and helping others, poorer hospitals that are part of their Catholic healthcare system. So it's not a money-making venture. It's a not-for-profit venture. As you put the money back into whatever money is made, it goes back into the running of the hospital and sharing those resources with poorer hospitals that don't have the resources. And that's the Catholic hospitals here now are part of large systems. And that's one of the advantages of a system. A wealthier hospital can help a poorer hospital and share those resources.
All right, thank you. And Professor Madondo, the same person who asked the first question, asked, so what can be done to assist the new generation of clergy and religious in exploiting church mission opportunities created by the continuously changing environment, globalization, international trade, and right now this crisis? Because he senses that these entrepreneurial skills and this disruptive attitude that you talked about is not so diffused among the missionary clergy and religious in Africa today. What do you respond to that, Barbara? Or Sister Anne, do you need to leave the webinar, or can you stay? You can stay. Okay. So whoever wants to answer.
I'll yield to Sister Anne first.
Yes, Sister Anne, please.
Yeah. The question clearly again is about Africa wanting to know, just to, is it written here?
No, because I received it
Okay.
by mail.
Okay.
So yeah, it says, what can you say about the disappearing, disrupted attitudes among current missionary religious and clergy, especially in Africa? And how can we help them in regaining these entrepreneurial skills and attitudes?
I think, you know, we need modeling, you know, we need to show the way, because, and sometimes we also generalize, you know. There are many Africans I know who are very missionary, and they do their best under very difficult circumstances, and they are good missionaries. Nonetheless, we've got to say that there is never enough of a good thing, you know. We want more of the good things. That many Africans, we need to build the culture of mission as part of us. Because it's a new thing, you know. Many of us, many parts of Africa have been used to receiving, you know. Now being part to give is something we need to learn to do, and we need to work on that through training, through modeling. That is showing examples ourselves, those who are convinced about the importance of mission. We need to live it out there in Africa as Africans. And as I used to tell them myself when I was a missionary in Latin America, I would tell them, it's a mission of the poor to the poor, to know how to be one more who is poor but serving the poor. It's all about learning in reflection to grow in that spirit. But we don't get results immediately. There will be itches, there will be difficulties, there will be incomprehension, there will be failures, but we keep going. I think it's a process. That's
okay, thank you. Another question for you, Sister Anne, is how do you deal with corruption in countries where this is diffused?
Yeah, I see that, you know, definitely it is a terrible thing, because it increases the suffering of the people. Sometimes in these countries, we missionaries replace governments virtually. We do things that by right is the government who should do it. But one of the things we do is, of course, we model transparency, accountability. That is number one. Number two is we need to build also within our structures in Africa, perhaps. I think Europe is doing very well in that. Advocacy and how to really network to challenge corrupt systems. We need to build that as part of our missionary strategy, because people are corrupt and they get away with it. And sometimes we missionaries have to build that skill in order, and I think Sister Dr. Barbra brought it up very clearly in her history, how missionaries also were part of the structures that confronted injustice in the system. I think these are skills that we as Africans perhaps need to develop, and it will be part of maybe curriculum for those who are training Africans as missionaries, you know, to be advocates of justice.
Okay, one of our students, Ornil, asked Sister Anne, in the management of your resources, do you involve lay people for some responsibility, or what are the criteria for choosing those with who you work with, if they are lay?
We have a network of staff, very big, and 99% of the people on all the projects are lay people. We hire people like normal, and most of the time, really, we hire what we get in the environment, because it's also a way of helping people. But we train them to suit the purposes for which our mission would benefit. So we work with lay people, we train them, and we also give them the same value of transparency and accountability. So it's an integral system in which we train a lot, or we spend a lot of time with staff training, and most of them are lay people and local people for that matter. We make it a priority to work with the local people because it's a way of also leaving a legacy with the people.
Thank you. And also Rosemary and Ruth, they both asked for some references. I may ask you later, you speakers, to send us some books on some articles that you think that might help in developing skills for holy entrepreneurship, not only in Africa, but also in the Western world, like Ireland, UK, and USA. And I think that what we heard from Professor Wall is also useful for those interested in developing holy entrepreneurship in the US. And she talked about, for example, how the Catholic missionaries, they got the money to run their activities, and she described really a model very much famous now as a social entrepreneurship. Mohammed Yunus got the Nobel Prize for this, and but we must say that he didn't invent anything, because the Catholic sister did it already 2 centuries ago almost. So, and but we can say that I mean, we will send you a list of references to read afterwards. So do you have anything to add for Professor Mann?
A whole training booklet that I don't have access. Well, I might. It's hard to get access to get them copied right now, but it's a manual that's about that thick. I don't mind sending that along. I would get permission from the people who wrote it, but I'm sure it's fine. It'll just have to wait until we can actually mail and get things going again. But there are other articles that I can send electronically. I can be thinking about that.
Thank you so much. So I think that we answered most of the questions, but we can we will sign all the other questions we didn't address, and we will send the answers by email to those who asked. If you
I think it's important. Somebody just asked about failure here. I think failure is actually relative, you know. Failure is relative, and I think it's part of life. Many ventures, either in business or in religious spheres, do not succeed, and there's no harm in that. We are people of prayer. Through prayer and reflection, we see what God really wants, and sometimes it doesn't work out the way we want it, and we listen and we reflect, and divine providence will provide the knowledge, the wisdom we need, and the lay people with us also give us a lot of insight.
Yes.
Thank you.
Yeah, the last question by Rosemary. Anne, thank you for sharing around IDP camps in Nigeria. I'm struggling with empowering IDPs in South Sudan. Many internally displaced persons learn to depend on humanitarian aid received, that they fail to become self-supporting, where war and conflict has been prolonged. Can you share how you help the IDPs to re-engage with their independent lives?
It's a very long process, and people are different. There are people you could actually who are eager to get back to life, to get out of the camp, and they learn, they start a new trade, and you see them making progress. You see people who are too traumatized and are depressed, and you need to accompany them for much longer. So it's a very tiring, patient work. And I really thank you for doing that in South Sudan. There are more IDPs in the world than people know, and any mission with them, it's a very, very important mission. we can discuss more. You can email me. I will send you some of the things I have used if you find them useful. Thank you.
Okay. So I think we can finish here. Thank you, Professor Barbra Wallman and Sister Anne Falola. Thank you very much for your speeches. And this was very insightful and inspiring for all of us and for the participants. I think we had many questions from them. I thank you all the attendees, and I hope that I will see you for the next seminar, which will be about the organizational design or religious orders, religious organizations who are that are internationalized, and this will be on May 14. And so this is the new appointment, and I hope to see you there. Thank you, everybody, and I finish here. Thank you.
Thank you, and thanks for all your help.
Thank you. Thank you.